When we are here with Abdoulaye Sabali, is community health volunteer. He's managing the health hut of Tayel. And here in this health hut, we are providing, or they are providing care in particularly in ERA, respiratory infection, children's diarrhea, and children malnutrition. Yes, here in Tayel. This health hut is supported by World Vision through the project named Community Health Project, funded by USAID and implemented by a consortium of NGOs. In this health hut, the community health volunteer is reporting to the ICP, meaning the nurse who stayed in Sarikoli, and he's working with matrons, let's say midwife, and some relay community health volunteer who are doing the work of sensitizing, let's say, awareness in terms of preventing infectious disease or children disease. And this health hut is rising, let's say, 6 villages, and here is the distance from the villages to the health huts. Here are the targets in terms of children under 59 months, children under 23 months, children between 6 and 11 months, children between 12 and 23 months, and children between 24 and 59 months, and pregnant women. So all these are the targets of the health huts. Here are the service provided by the health hut. Among them we have the prevention and treatment of malaria, prevention of and treatment of diarrhea, of infection, respiratory infections, half of the mothers, preparation to birthing, and all the birth spacing, nutrition, prevention of HIV/AIDS, of yes, tuberculosis, all these mutual genetics of women. They are monitoring the case of main disease. Main disease here are malaria, diarrhea, and pneumonia, is respiratory infection. And this curve is for this year, since January, it's showing evolution of the different case of people who are ill of diarrhea, malaria, and respiratory infections. Here is a monthly monitoring of children's malnutrition. Children that are up to 0 to 33 months. And here's the red one is showing the malnutrition evolution. And when the malnutrition rate, the monthly rate, yes, is about 7%, then they have to discuss with the community. They report this result to the communities during a meeting, and then they come to the decision to open what is called FAN. It's equal to PDQ, and during these PDQ that take 3 months, activities are implemented in terms of awareness of malnutrition causes, how to prevent malnutrition, how to prepare dietetic meals for children, and how to follow the case of moderate malnutrition. And after 3 months, normally the children can be out of the situation of moderate malnutrition, and then they are followed at the household level by the ruling, the community facilitators. And if there is a case of severe malnutrition, then this case is referred to the health post, and from the health post to the CREM, which is a center of malnutrition recuperation. Thanks.